Experts in the Eastern Cape region want a possible lockdown as a third wave of the coronavirus is forecast to make an impact by next week.
Academics from Nelson Mandela Bay University have shared their latest modeling for a potential resurgence in COVID-19. They believe that history could repeat itself in the Eastern Cape with the first noticeable rise in cases expected even before Easter.
Yeah, and to speak to us about this, we're now joined by the Executive Dean of the Faculty of Science at Nelson Mandela University, Professor Azwinndini Muronga. Professor, very good morning to you. Welcome to the AM edition of Newsfeed right here on Newzroom Afrika. We spoke to the health minister yesterday, and questions were posed about the country in its entirety, where it's standing, and what could happen as we go into the Easter long weekend. And he assured us that we're not going to go back to a level 5 hard lockdown, but the Eastern Cape is a different province in its entirety. The research shows that there really is a need to do something very soon.
Morning to your viewers. Yes, and in the modeling that we have been conducting over the whole year, and let me remind you and the viewers that today marks exactly 1 year since the reported first death due to COVID-19. And we are now standing countrywide at about 52,500 plus cases of death. And the reason I'm mentioning this is because we have been following the cases of death in one of the models. We've got 2 models. One of the models follows mainly the number of death cases due to COVID-19. The reason we do that is because there is not much ambiguity in the number of deaths as compared to ambiguities around the number of positive cases that you hear about daily. And therefore, the model on death cases is more reliable. We have been following for the past years, from the 5th of March up to date, we have been looking back in history, and we have been trying to find trends and locate various stages in our country as to what happens when we went through various lockdown stages. When it comes to the Eastern Cape, we were almost caught off guard, even ourselves who were conducting these models, because we thought after the first wave, the virus was going down. It was really going to get tired. But when the second wave started in the Eastern Cape, we were caught off guard. And this time around, instead of waiting for the wave to start emerging and start doing the modeling, we decided that it's better to start to look at the signals of any potential resurgence of any wave. And you will recall that if there is going to be a tsunami in an ocean, usually you'll see that the waters on the shoreline will recede, to drain away. And this is what exactly we're seeing in the Western Cape, but of course also in the rest of the country. But in the Eastern Cape, we are seeing that the numbers are indeed going down. But if we start to look now, at least around this week, and this is the trend in the country, you will start to see that the positive cases for the tests that are conducted are starting to rise. In the country, for the 3 times in the past 5 days, 7 days, let me say, those positive cases for all the tests that are being conducted are starting to sharply increase, and that is a worry. And what we are saying is that let us intensify on the testing, and that will also start to tell us whether really this third wave is on the rise.
Now, Professor Muronga, regarding the data that you have been able to extract from all the tests and looking back at the historical data, why is it that the Eastern Cape has struggled so much? Despite being ill-prepared, somebody could argue that there were other parts of the country that were also ill-prepared, but the Eastern Cape is a very interesting anomaly in terms of the amount of fatalities that there has been over the last 2 waves.
Yes, and this is a puzzling question on its own. So I think the government and the provincial government have also become aware of some of the factors that are the causes of more fatalities in the Eastern Cape. And when you look at the data and when you start to dissect the data, you look at it microscopically and you look at those who are actually impacted most and the fatalities that we see. You will see that these are the events, the super spreader events that the majority of our old people attend. Your funerals, your after funerals, and other gatherings. And therefore, you expect that population, which is mostly affected by the pandemic, to be the one that will be hit hard. And in the Eastern Cape also, due to most cultural activities that took place also in the region, and of course following traditions and as we go towards the winter, we will see most of those emerging unless we do something and unless we start to educate people, because out of this study that we have, especially in the Eastern Cape, given what we have experienced, we have also realized that there is lack of science communication, lack of education about the social and the science factors on the COVID itself. And we have been prioritizing as the Eastern Cape on when the wave starts, what do we do now? And we are calling on the provincial government and the national government to intensify on the awareness campaign that this virus has not get tired. We might be tired, but it's not tired.
As you make those calls, Professor, what sort of reaction are you getting from government as you make this proposal and put forward your studies and your research, especially now we're looking ahead of Easter?
Yes, my colleague and partner in this assessment, Prof. Darrell van Kronen, is very much involved in almost day-to-day engagement with the provincial government, and there is some light in the end of the tunnel. What is lacking again? It's what we see. Let me say what we see. It's